Hi everybody, I'm Dr. Tim Dunne with Advocate Integrative Medicine, and today I am here with our nurse practitioner.
Hi, I'm Dr. Holly Dockery.
And we wanted to give you folks an insight into some of our conversations that we have here on a daily basis. So we wanted to start with what's really important to us as providers. Not only as providers to the people that come into our office, but we wanted to let you know what are things that we want to set up for you before you get here, before you make the phone call, and before you have your conversations. So there's just a handful of key things that we think are really important, Dr. Holly. And what are some of those things?
So one of the things that I have implemented that's important to me, because I'm a tall woman, I like to be able to sit down and actually look at my patients. Sometimes I find that when my patients are sitting down and I'm standing, it's like I'm leering over them, and I don't want to be intimidating, and I want it to be an open relationship where we can talk freely and really communicate. And so I've got a little stool, and I sit on my stool and I talk to my patients while they're sitting in a chair, and so we can look eye to eye at one another. And that's really important to me at just establishing that relationship and not making it such a authoritative encounter.
Exactly, so you're both on the same level.
Yeah.
So you're there to communicate, you're there to help them.
Yes.
So that leads me into the next thought, is that when you're on the same level and you're on your stool, one of the things that I think is lost in healthcare is touching patients.
Mm-hmm.
Can you get into that a little bit?
Absolutely. I mean, there's a lot of information to be gained from talking to someone. You learn what their concerns are, what their needs are. There's a lot of information to be gained there, but then there's this next level of physical exam where you lay your hands on a person and you're physically finding out even more information, and that's objective data from a physical exam standpoint. And once again, that's building relationship, that's layering your exam, that's finding out all the information that you can from all angles, and so that's really important.
And it's letting people know that you care, that you're going to take the time, you're going to break that barrier between them. You know, us as chiropractors, this is what we do. So for us, it's not something that's new. It's part of our daily being. So it's not just during exams that we lay hands on people, it's every visit. So for us, this is kind of new, but this is something that I think is being lost a little bit in healthcare.
Definitely.
It's really connecting. It's one thing to connect when you and I are knee to knee, but it's another thing that when you put your hands on someone and they feel that you care.
Absolutely.
They feel that you're engaged with getting them better. Critical
Absolutely.
pieces.
Yeah.
Critical pieces. You know, folks, one of the things that's very important to me, and we work hard here at the office, is if you have an appointment to see myself or Dr. Holly, say at 10 o'clock, I want you to be walking in the room and sitting down at 10 o'clock. That for me, you've heard me preach this around here, it's a broken record. So if on our schedule, we have you down at 10 o'clock, that means that our front desk and our administration is probably gonna have you here ahead of time, like at 9:30. So that's why we have you go to the website and download our first day's paperwork and do that at home so that we can get you in with our provider at 10 o'clock. If you're not able to do that, we may bring you in at 9 or 9:15 to make sure that these things are being done so that you see the provider at 10 o'clock. For me, that's critical.
Yeah.
As a chiropractor, we can get patients in and out. We can get them moving. But your schedule is very set. So it's important for me because our patient's time is just as valuable as our time or anyone else's.
Absolutely.
And we want to create an atmosphere, folks, that we respect you, we respect your time, and we want to create an atmosphere that you enjoy or you look forward to coming to see us.
Yes.
Where you can explain more of what you have going on, and you can give not only answers, but lifestyle choices.
Yeah, so it's nice to be able, when you come in on your appointment time, just to be able to sit down and really address what the needs are at that appointment, and we can address it fully, and just really connect and make sure that your needs are getting met.
I had a conversation with a patient, today is Thursday as we're shooting, and it was Tuesday, and she was saying that the one thing that she feels that is so important about our facility that she doesn't get elsewhere is that we listen, we care about what she has going on, we're constantly making changes to the patient's care plan, and that you and I work with the patient. And what is that called?
Yeah, so shared decision making is a really important component to healthcare where, you know, you're my patient, I'm the provider, but it can't just be me making decisions and telling you what to do. It has to be, you know, we have all these different options and all these different things we can do, and what is reasonable and feasible for you as the patient, and then how am I going to fit into your needs as the provider to get you to where you need to be health-wise. So it's just working together, and that's just all shared decision making is what that is. Yeah. Critical,
because you and I realize we can lay out the perfect plan for the patient, but we have to look at the likelihood of that plan being completed.
Yes, and not every plan, not every treatment course is going to be the same for every patient, because every patient is individual. So.
Yes. So that for us is very important, folks, that we communicate with you, that we understand you, and we understand what is going to be done outside the office or at home and what is not. Because then you and I can then work with them to get them one step at a time. Critical things, so listening to patients, getting down at knee level and touching patients, their time, and shared decision making. That for us, I think, is very, very important here for all of us.
Yeah, and I think we're doing a really good job at that, and just as an office as a whole, like all communicating together, and if we're finding something that's not working from our standpoint, implementing changes to help make things better for the patients. Always just kind of working on positive change.
And one of the things that we had thought of the other day was that we want to make sure that our insurance people are always sitting down knee to knee with our patients to make sure that their questions are going to be answered, and those questions are going to be asked, because they may not know what questions to ask.
Yeah.
So that there's no hidden fees that always seem to crop up. You know, you go and have a procedure done, and my goodness, you get a bill from this provider, that one, and the other, as well as the facility. It would have been nice to know that up front.
Absolutely. Yeah.
Again, so there you go, folks. There's 5 things that for Dr. Holly and I are really critically important. And then everything else builds from there. Everything else moves from there. So I hope this helps. If you have any questions, please call our office. I'm sure we have links to click somewhere, somehow, on this video. So please click it, share it, love it, let others know about it, because folks, we're here for you. We want to help you. We want to love on you. And we want to be that piece of your healthcare puzzle that moves you forward for the life that you deserve to live. So give us a call at Advocate Integrated Medicine.